Jason Pickell, and I want to talk about a patient today that had recently come in. A few months prior, he had gone to his one of his doctors, and that doctor had run some blood on him and found out that his blood sugar was high. So he told him that he was pretty much diabetes type 2, kind of borderline, which could also be insulin resistance or pre-diabetes. So again, he left with multiple prescriptions. He left with a prescription for metformin for his blood sugar. He left with a prescription for high blood pressure. He left with a prescription for of antacids. He left with in fact, he left with a couple of other prescriptions besides that. So quite a few different drugs used, and basically it scared him to death. So number one, he was having quite a few symptoms there. He was getting a lot of fatigue, especially after he ate a meal. He told me when he eats a meal, he just feels like he needs to go take a nap right afterwards. And then also he's craving sugars. He said not only did he need to take a nap after meals, but he could eat this big giant meal. Not only would he still be hungry, but he would be especially hungry for sweets. He was like, okay, I just ate this meal, but now I need something sweet. I've got to have it. And it would just bug him to death. So, and then on top of that, he was trying to exercise, and he's been through about 3 different diet programs, and he can't seem to lose weight. And in fact, the combination of diet and exercise actually made him feel worse, and made him feel at one point like he was having heart palpitations. He said he was hungry all the time, and also, again, he had migrating aches and pains throughout his body. Yes, these are all symptoms of diabetes type 2, insulin resistance, pre-diabetes, that whole spectrum of blood sugar problems. But what's really going on here? Okay, this person has an obvious problem with an ability or to produce insulin, or he's not making insulin when he should, or there's other factors going on. And typically the first thing that most doctors and most people think when they think of diabetes type 2 or any other form is the pancreas. And we've got to stop it with the pancreas. The pancreas makes insulin, but he's not always the cause of the problem. Now, what does your metformin or glucophage do? They force that pancreas to make more insulin, make more insulin, make more insulin. This isn't good. This can cause pancreatic fatigue after a while, but medically that's not an issue, because if the pancreas finally fatigues and gives out, what do? We'll just inject them with insulin. Yeah, no, that's not the way to go with this. Once you are on insulin, game over. Your insulin is inflammatory. It is something that we need. It's supposed to do its job and leave, but you start putting insulin into the body, you have just produced a lot of inflammation, and you're producing other effects in your body. In fact, a recent study showed that insulin and high blood pressure levels go hand in hand. So you cause an insulin surge, you increase your insulin, what happens? Your blood pressure goes up. Of course, let's give the person insulin and a blood pressure medication to counter that. No, that's again not the answer. The thing is to find out what's causing this blood sugar issue. And typically, it's 2 of the other players in the game, which actually 3 of the other players, but we're not going to talk about the thyroid right now. The 2 other players are your liver, which stores your blood sugar in a form called glycogen, and also your adrenal glands, which make a hormone called cortisol, which is crucial to releasing that stored blood sugar and doing a bunch of other things in the body. The problem is if cortisol goes high or if it goes too low, that in itself will cause blood sugar problems. So is this a pancreas problem and we just need to make more insulin? Or do we need to look at those adrenal glands? Do we need to find out what they're doing? Are they functioning properly? Is this issue due to that? Or is it due to a liver issue? Do we have a really poor diet? Our liver is basically toxic and is having all kinds of issues there, and it's inflamed. So it's not going to release that blood sugar properly. There's actually quite a few different possibilities here as far as causative factors when it comes to diabetes type 2. So before you jump into the medication game that is really a road to nowhere, first let's take a step back, do some investigating, and look at the whole picture. Let's look at quite a few different labs there. There's also a condition called latent autoimmune diabetes in adults. We need to find out if this is a factor, because some patients that don't get diabetic symptoms until they reach adulthood, that can be a cause. So we also need to even look at some antibodies. But the thing is to look at all the possibilities, and you need a doctor who's going to do this, who's going to look at all the possibilities that could be causing this. Get those under control. Otherwise, the common thing of take the medication, eat right, and exercise could actually make you worse and lead to other problems. All right, I'll talk to you on the next video, and thank you.